I have many patients who manage their prolapse with a pessary, but one of the things I always hear them complaining about is that it's really uncomfortable when they try to take the pessary out or reinsert it. So today I'm going to give you my tips of how I insert a pessary in a patient, which for the most part is not very painful and it's very quick. So this is a common pessary that we use. It's called ring with support. As you can see, it has little holes over here and we'll use it to our advantage. Pessary is made up of silicone and it's very pliable. What that means is it's soft enough that you can bend it. So what I usually do for my ring pessaries with support, I fold it along the axis of these two large circles. So once I fold it, it actually becomes like a little taco. So it's much easier to try to insert the pessary when it's folded like this as opposed to when it's wide open. I don't like putting lube all across the pessary when I'm inserting it because then it becomes very slippery and I find it very difficult to fold it and hold on to it. So what I do is I fold it, I put a little bit of lube right at the tip. If this right here is the vaginal canal, I put it inside. I push on the posterior vaginal wall. The reason for that is if you touch the anterior wall or the top wall, the clitoris is right here and that area can be really sensitive. So I'm actually very careful to make sure that, I'm kind of pushing onto that posterior vaginal wall. I have lube right at the tip, which makes it easy to insert, and then I'm holding it the whole time and pushing it in and making sure I don't pop it open because that can be, again, painful for the patient. So I try to hold it as much as I can. And then once it's inside the vagina completely, I push it in as far back as I can so that it goes behind the pubic bone. A lot of the times if the pessary is right at the tip or right at the vaginal opening, that's where patients can feel a lot of discomfort and feeling like something is stuck there. So you push it all the way in behind the pubic bone can be really helpful.